time to welcome in once again from the Foundation for Community Health, Nancy Heaton, who is the CEO for the foundation, and we wish her a good morning. Thanks for joining us this morning, Nancy.
Good morning to you, too.
We are here at Robin Hood Radio going to be featuring a bunch of interviews over the course of the year with not only the Foundation for Community Health, but the different people that the foundation deals with and the effects that the foundation has throughout our tri-state area with what they have done since they have been around, by the way, since 2003. And these will go throughout the year, and you'll get a better look at some of the behind-the-scenes things that you might hear about once but forget about what the foundation does. Nancy, first of all, thanks for joining us. And really, it's been quite an amazing rise from your beginning of 2003 with promise, with funds because of what happened with the Sharon Hospital. But the way that you have all stepped in and took that promise and took it to several steps more than the original idea, I think is amazing.
Well, thank you. I mean, I actually have to give credit really to the founding board. I know that they were selected by, by a process that really looked into people who were very committed to the community. And so when I was hired 6 months into it, so I've been here about 17 years now. They'd already decided that we wanted to be much more than just have people send in, applications and fund things randomly, but that they wanted to look at what the needs in the community were and help the community to figure out how to solve some of those things.
It's interesting. I remember when you were first founded. I remember when the idea was first floated. There were some people that doubted the idea of what you could do with what you could do with that money, and some people didn't think it was enough. Some people thought it was too much. But I think that you as a board and you as an organization just really took your time setting up what you wanted to do. Obviously you had short-term goals and long-term goals, and everybody there has to be very, very happy with what has developed over the past 17 or 18 years, because you really do now. You are a lifeline for a lot of interesting projects that all deal with health and wellness in our tri-state area, not just Connecticut.
Correct. So our service area actually reflects, the original Sharon Hospital service area. So we do cover 9 towns in Connecticut and about 8 towns, including villages and all of that in New York State. But it is primarily a rural community. It's probably still less than 60,000 people that we cover, and that includes probably all the new people who may have moved into the area due to the COVID crisis. But so we need to also look through our rural lens as to how we can, accomplish things. So we did spend our first 17 years to date really looking at access, because that was the issue that came up, because we are a rural community. So access to health-related services, things that would contribute to the health and well-being of the community. And really that was our focus with this lens for rural, a lens for prevention, an approach that really focused on collaboration and engagement. So we wanted to find out what the community needed, and so we asked, and then we also wanted to find out what they felt some of the solutions would be. And, we're a foundation, so we don't actually do, right? So all of our work has to be done in partnership with the nonprofit community and leaders in the community in order to do anything.
We are speaking with Nancy Heaton, CEO of the Foundation for Community Health. Forgive me if I'm wrong, because at 68, my memory can get a little fuzzy. But wasn't one of the first things that you guys really got involved in was oral health for students in the community?
Yes, thanks to Dr. Nuia, who was on our board at the time, a local dentist. He was aware of some programs that were working in other communities, and so we actually engaged some postgraduate students from Harvard to come and literally do a in-mouth check of every third grader in our catchment area. And we found that indeed, even though it seemed as if our communities might have adequate dental care, we actually proved by counting cavities and counting the fact that there were, I think, less than 40% of our kids had actual sealants, which are an indication that they didn't have enough prevention services. And so from that, we developed the in-school program. So most of our schools have, from K through 8, free oral health screenings, cleanings, and sealants.
What's interesting about that is you took the time to investigate it beforehand and then come up with a plan. That's the thing that I remember when it was first announced and done. That's just something that I think was one of the first things that the foundation did.
It is, and it's probably a best example of one of our approaches, which is if we, that wasn't something. The need came out of the needs assessment.
Yep.
So there was a need. They said that there was a lack of dental services available in our community that were easily accessible by everyone. But we put our prevention lens on it. We decided to do, some data and make sure that really was an issue, and then help to bring an evidence-based program. Basically, we didn't design it. It has been proven to be effective for these children to get these prevention services so that they can have a lifetime free of some of the things that, our generation have to suffer with our teeth.
Well, I just remember when I was a kid, the big thing was fluoride. Half the people wanted you to take it, and the other half didn't want fluoride.
That's still an issue.
I know. But that's just one of the things. I mean, one of the latest things that I think you got involved in with granting and helping, and it's an interesting program that really has been waylaid by COVID-19, and that is your effort to put the first in-school health center in Dutchess County in the Webertuck Central School District.
Yes, again, that's actually an example of a different kind of thing. So this was a group that actually identified its need and went out and looked for a solution. And then when we, became aware of it, we said, "Oh my God, this is, one of the best ideas." So it helps with access. So if you put a school-based health clinic in a school, parents don't have to worry about, taking kids out of school and transportation to services that may or may not be close by, and a school-based health center that is a full service one will actually provide not only primary care but also oral health and mental health services, and so it really is a great access point for the community. So we're very excited to participate in that, but we cannot take credit for the initial idea because it came from the community, and we're very excited about that.
But I think that's one of the things that stands out about the Foundation for Community Health is you don't have to think and reimagine the wheel, but when people come to you with ideas and you do the investigation and then you help fund and put the ideas together, I would think that's really what your mission statement is.
Exactly. Another example that we're all very proud of, even though, again, we don't do the work, remember that, but at the Northwest Connecticut Community College, approached us, the former dean approached us and said, we should have our own nursing program here. We're one of the few states that every community college does not have a nursing program, and what we find is our area, the people who go to nursing school somewhere else end up working somewhere else. And we did know that there was a need to bring in more, health care professionals to work in our community, and so we gave the first grant for the feasibility study, and they were able to leverage that grant, and they went out to the community, I think raised a total of $1 million just from community businesses also. And we supported that, the person running that program for about 4 or 5 years in a row so that we could make sure that it was established and would have a life of its own afterwards. And it's a great program that's still operating today.
We're speaking with Nancy Heaton once again from the Foundation for Community Health. And I guess we should really talk about that you also helped in setting up the Health and Wellness Center in Canaan.
Well, it's not there yet, but we've been working on that for some time, and we have made great progress. And I'm very excited about bringing more primary care and behavioral health services in particular to the North Canaan area. So there's going to be more news on that front. So let's hold that excitement.
Now are you working also as well with Sharon Hospital now that once again Sharon Hospital is a not-for-profit?
It's not that we're not working with Sharon Hospital. I'm actually a member of their community needs assessment committee and have been for a couple of years. And so whenever I bring my expertise and share our contacts with that committee and looking at what it is that Sharon Hospital can do going forward. So we've always been a partner.
And I know as a small nonprofit and as a small business, we were part of the people that received some of the rapid response grants that you once again very quickly went into action with at the Foundation for Community Health to help nonprofits leverage their way, whatever way possible, through the pandemic. And once again, I'll thank you on the air. I sent you a thank you letter. I mean, that really helped. It's amazing when you're a small business, and especially if you're a nonprofit. It's harder and harder, especially in times like this, to keep that support going. And that I think how quickly you put it together and how well you executed it. Once again, it was just absolutely amazing.
Well, we really felt like what we needed to do was to try and protect the safety net and those organizations that were doing some on-the-ground work. So we actually set the limit to only fund organizations that were about $1 million in their in their budget, and ask them to come up with what it is that they needed. It worked because we actually went online because of all of this. We started an online application process, and so while everyone was working remotely, it was an easy application and an easy thing for us to turn around in house. So that was very exciting for us, and we've spent so far around $250,000. That most of that on that response phase, so just with people, we did a lot of food access money, basic needs, some healthcare delivery programs, some information programs, but we are also looking towards just giving general operating, and we converted, and in addition to that 250, we converted all of our current grants that providers had to just be general operating, if that's what was appropriate for them, because most of them couldn't go back into the schools, for example, to do the work that they normally do. So really, our efforts were way beyond the 250,000, just trying to respond. And now we're looking towards recovery. So we are working with collaboratives in both states, other funders, to see what we can offer. What we're calling our safety net social service organizations, something to get through the next phase, which is going to be as difficult probably.
Yeah, well, I think the way you've expanded what you do and how you reach and who you reach, and also the seminars you also offer to the nonprofit community has all worked out. And do you think, how happy are you and the board with where you sit right now, over 20 years into this right now, and living through the time that we're living through? How happy are you with the way things are going?
Well, I think, everything should always be reviewed and reevaluated, and we're currently in that process. We were going to put it off, but we decided, this may be the perfect time for us to go through a strategic planning process. And we've spent almost $18 million in grants over the last, 17 and a half or so years. We're looking at that. We're looking to see what worked for us, what were more successful things, why were they successful, and while we've always had, and we will continue to have the same approach, let's engage the community, let's make sure we look at some data, let's work with our partners to be successful. We may, there are more trends now towards, some changes in how we might get the money out there. COVID showed us how quickly we can turn around things and how much people or organizations were able to just be very effective in using that fund. So, we're looking at all of that now. We should come out with a new strategic plan probably in the early spring sometime. So that's kind of exciting for us. It's a very reflective time, and I think we're all learning. We're even using a book called Giving Done Right as sort of a primer on effective philanthropy, just to make sure we are, doing the right things by our community.
I just think it's amazing when you look back over 20 years ago. The sale of Sharon Hospital was a pivotal point in this area, and the people that put this together originally to take funds from that and put it towards our own community, it's worked out perfectly. And congratulations to all of you. And I hope you guys get back. Are you back in the office yet? Or are you still all remote?
Well, 2 of us are, so
Okay.
2 out of 4. It works very well for that. I need to get out of my house. All my kids are home. So,
I know,
they're young adults. So.
I just go from the radio station to home and back to the radio station. So at 68 and being overweight, I don't want to take my chances. Well, Nancy, again, thanks for joining us today, and much success, continued success at the Foundation for Community Health.
Well, look for more information in these upcoming, sessions to learn more about the people who are involved in the Foundation for Community Health and the grantees that are really the backbone of our work.
All right, foundationforcommunityhealth.org on the web. Nancy, thanks for joining us today.
Take care. Bye.
All right. The Foundation for Community Health. What a terrific success story.